colleagues, friends, associates from different parts of the world. I greet you from a beautiful sunny Johannesburg. Welcome to this webinar this morning as part of the conference. This morning we focus on social issues and road safety. Our esteemed speaker is Marie Hasselberg. She is a well-known injury epidemiologist with deep history of work in traffic safety. She has a background in sociology and is currently the head of the Department of Global Public Health at Karolinska Institute. Marie has provided a very brief bio, and I take it that she doesn't enjoy lengthy introductions. So we're looking forward to this morning's webinar. Marie and I are going to try and keep it interactive. Marie has a PowerPoint presentation that she's going to use and to talk to. I will interject at different points as per our discussion. Marie and I had a discussion to keep it interactive and to keep the session animated. We'll also keep an eye on the questions as they come in and try and flag them for Marie. We take a rather broad view of what is meant by social issues, and we'll hope to use this opportunity, Marie's presentation, to raise some issues that are perhaps looking at how traffic safety researchers produce knowledge, the kinds of questions they ask, and the logics internal to the science of traffic safety and the social issues that those logics raise, the social political issues. And then we'll also look outwards towards some of the different environments and the social, political, economic constraints that shape and impact on the work of traffic safety. So the questions and the discussion is fairly broad, and we're hoping to introduce ideas and concepts that may tend to be marginal to what occupies most traffic safety and injury researchers and practitioners. Marie, so let me get over to you. I don't know if there's anything else you want to add by way of introduction, but let me hand over to you, and as you proceeded, as I indicated, I will interject at different points just to keep it animated and move away so that it's not a monologue. So over to you, Marie.
Thank you very much, Mohamed, and good morning to all of you, and from a very sunny but rather cold Stockholm. So as Mohamed said, I'm head of the Department of Global Public Health at Karolinska Institutet in Stockholm, and I belong to a research group called ISAC. It stands for Injuries, Social Etiology and Consequences. So we have a special focus on looking at social determinants of different types of injuries, but also the social consequences of injuries. And I'm well aware that I come from a high-income country with one of the lowest number of road traffic fatalities in the world, Sweden, and also with a long history of road safety with quite interested policy makers when it comes to road safety. But that's why I'm very happy to have this dialogue together with Mohamed that come from a totally different context, and I have been in other countries. So I do collaborative work with Tanzania. We have road safety projects in Tanzania, and I have worked in other low and middle income countries as well. So with that, I will start my presentation, and then we'll try to have a good discussion with our different perspectives. So why do we have to discuss social issues and road safety? Why is the need to do that? Well, traffic affects all of us. We are all in traffic. We're all exposed to traffic more or less every day. So it's part of our lives, and it's part of our social life as well. And the morbidity and the mortality due to road traffic injuries affect public health, but also social inclusion, national productivity, and economic progress. So it's definitely something that affects our lives, both in high-income countries and even more so in low and middle-income countries. There are a significant body of evidence that shows that lower socioeconomic groups, particularly in poorer countries, in poorer environments, are more affected by road traffic injuries than those from more affluent areas or higher socioeconomic groups. So it's a difference between countries, between regions, and between socioeconomic groups. Are you ready, Mohamed? You seem to have some things around you, but okay, I will continue. So there are studies since the 1980s and onwards showing the unequal distribution of road traffic injuries in the world and between regions, as I said. And those studies are both based on area-based level data based on more deprived areas and more affluent areas, but also data that is more individual-based. And all of us know that more than 90% of all deaths in road traffic occur in low and middle income countries, even though they only have 20% of the registered vehicles. So the pattern is more that in high income countries, it's more people within the car, so it's car passengers and car drivers that are injured in traffic. And in low and middle income countries, it's more pedestrians and vulnerable road users. And just looking at children, we see that the fatalities per 100,000 is 6 times higher in low and middle income countries for children in low and middle income countries compared to children in high income countries. So it's a big difference. This is a systematic review from 2010, where we looked at different studies looking at socioeconomic differences in road traffic injuries among young people up to the age of 24. And we looked at 37 studies. Most of them were from high-income countries, 26 from European countries. There were a mix of area level-based studies and individual level-based studies, and also 4 multi-level studies. We looked at those studies looked at different type of road users. So the purple bar here shows number of studies included in the review, and the green one is positive association between lower socioeconomic group and road traffic injury, or more deprived areas and road traffic injury. The gray one is more negative association, and the darkest one is non-association. As you can see, most studies were done on pedestrian injuries, followed by car passengers and bicyclists, and most of them show a positive association between socioeconomic position or deprivation of the area and the risk of having a road traffic injury. When we look at the social determinants of health or social determinants of injury risk, we have to understand that the individual living condition or the individual lifestyle factors are affected by the living condition, the social and community networks that the people live in or belong to, and the living and working conditions that they are within. So both work and unemployment, water, sanitation, housing, and of course the environment and education will affect the way that we form and shape our individual lifestyle factors. And then of course also the more societal, socioeconomic, cultural, and environmental conditions that we live in. And the same will be, and the same is for individual road safety behavior. we have to look at that also from a perspective, where are people, what type of problem do people have, what type of network and families and communities are they living in, what type of living conditions do they have. And all of those different levels will also shape the more individual road safety behavior. However, we tend to look at the individual behavior as an isolated factor. So we look more towards the human errors, which is also at the end of the causal chain towards an injury event. So it's a need to look at more upstream, more latent conditions, why people are, why they have those individual road safety behavior or not have them. So of course, as I said, people are facing other type of problems. People have, they might be unemployed, they have difficulties to have money for feeding their children, and they have other problems in life that will also affect their willingness to actually be safe or buy safety. And for the individual, road traffic injury is also a rare event. So there might be more benefits for the individual to actually use the car or to speed. And the direct effect is not obvious for the individual. So the benefits are higher than the risk of having an injury. On the other hand, for the society, it's more a cost for premature death and injuries and disability. So the cost is more on the societal level, but for the individual, there might be lots of benefits of using cars or speeding, which is fine. So it's a contradiction between gains and responsibility. Another of those contradictions is that when we look at public transport or pedestrian safety, infrastructure for pedestrians, the cost for that is usually on the local level. So it's the local municipality that have the cost to improve safety for pedestrians. On the other hand, again, the gain of that will be more on a national level to save money for having healthy and productive people within the society.
So, Marie, can I interject here?
Yeah.
That was, thanks for the great opening, and I think you provided an important case, an empirical case for why traffic safety continues to be a priority, a global priority, not just public health priority, but a social and social science priority as well as a political priority. So I want to prompt and ask you to think, for us to think together. When you look at your initial slide, I think it's your third slide, where you indicate that the burden is, traffic death burden is concentrated in low middle income countries. That in itself is not contestable, it's true. But I'm wondering the way in which the magnitude and the data on magnitude, as well as the patterns of traffic, get articulated and presented. It's almost as if one wonders what the effect of such representation is. So in a sense, the data reproduces the dominant narrative that creates a hierarchy. It places low middle income countries lower on the hierarchy of development, and in this case, lower down on the hierarchy of safety. And it reproduces that dominant narrative that always presents low middle income countries as deficient, as lacking. When you set up a comparison between low and middle income, it sets up a binary, and the message is, well, if you become high income and you follow the high income model of path to development, your traffic problems are going to end. So I wondered whether you have some thoughts on that. How do we present this important information without reproducing this binary and this kind of polarity between, you know, the North and the South, basically. That's the effect that one sees from this kind of presentation. It's not contesting the data, but what does it do? It creates a binary, and it always, I guess, puts the South on the back foot. That we are constantly in search, and, you know, we have to catch up with the North, with the high income country. So I wondered if you had thoughts on how one could present this kind of information in a less polarized way, in a less binary way.
Yeah, thank you. I think it's a very important point that you bring up, and I was actually thinking about that with my slide. I think we have that problem for anything that we classify in different groups. So it will be the same discussion classifying lower socioeconomic groups in Sweden or higher socioeconomic groups, that you stigmatize some of the groups. So we always have that problem. But I agree that we have a problem if we tend to polarize the problem into different or and put it in a hierarchy, which is it's not. It's more a matter of showing the problem. And I will come back to the difficulties of economic growth and road safety, because I don't think that, or I will show also that, I mean, economic growth is, of course, obviously very important for many countries, especially the countries with a high level of poverty. But at the same time, low and middle income countries don't have to go through the same process of motorization as we have done in high income countries, because it's not the way that we're supposed to do development nowadays. So a modern development will go another way. We don't have to go through all the mistakes taken by the high income countries. So I do think that, I mean, mobile phones is one example where they skipped the development over computers and landlines and networks and things. So I do believe that we should discuss the problem of road safety from the perspective of different contexts, and maybe putting them in low and middle income countries and high income countries is not the best way. Global South and Global North is the new way of formulating it. I'm not sure if that's better, but at the same time we have to, or maybe don't have to, but it's a way of showing where the problem is. But maybe it's also a better way to say what type of problem you have and the pattern of road traffic injuries than just looking at the number of them.
I guess it's a paradox, you know, that one has to deal with. You have to highlight the problem to secure the public attention, political attention, and so forth. At the same time, you know, that there's these challenges in rethinking how such information gets presented without stigmatizing and reproducing. But it's also, I guess, and I'll come to my follow-up question, is, as you indicated, your systematic review is based on published studies, and it's really northern-centric. They're very limited data and studies included from elsewhere. And what are the implications of that? How does that empirical evidence travel across different zones of the world? And how would somebody sitting in Cali engage with this data that you presented, you know, the systematic review, or somebody in New Delhi, taking a more situated approach? What are the cautions, I guess, you would want to alert people to, given the distorted database that you pointed out to?
Yeah, so I don't think it travels well globally, but I think it's so the message from those studies are more that even in high-income countries, even in countries like Sweden, we do have different socioeconomic differences in injury risk and in road safety. And that says something for all countries. So we know that even in Sweden, which is a high-income country, we have those people that are brought up in more lower socioeconomic groups have higher risk of road safety. And that's in a country where we have a very safe road environment. So it's something that's a message that translates to every country. And again, I mean, it's the same for health, that we know that poor people are worse off when it comes to health and then injury risk as well and road safety.
Okay, thanks. Those were the two I just had for now.
That's
I'm sure
great.
you want to
Thank you
continue.
for that. Yeah. So going back to the society and how society can actually affect how people are divided into social groups or social positions. So the society decides how we distribute or not distribute wealth, power, and money. So in a sense, the labor policies, the educational policies, and the social policies that we have in a society will also decide how people are stratified into social strata and individual position. And those individual positions will then form and shape their lives in different ways and give them different life chances or life conditions. So when we talk about social groups or social positions, we talk about a comparison between different social groups, not between individuals. And those groups are have the same, as I said, living conditions. So it's structural position independent on those individuals that occupy them at the moment. It's more the groups that we talk about, and that's the social differences in those. And those are usually measured by education, income, occupations, sometimes also gender or ethnicity, but these are the more socioeconomic measures that are usually used. And those are used as being the same many times, but they actually reflect different perspectives or different aspects of social stratification. So education will more measure how you can, if you can have access to information and it can assimilate the information. Income will more be a measure of how well you can buy safety, if you can decide where you want to live, if you can live in a safe environment, in a safe neighborhood, and also if you can buy, of course, safety equipment and other safety things. Occupation, on the other hand, include both of those, both education and income, but it also includes something else, or power. And to have power and something to say, have a say in society. So you might be closer to the policy making in some occupations than others, have a stronger voice for that. And then if we talk about the mechanisms leading from social position to injury risk, then we talk about differential exposures. So people might be differently exposed to risks, both type of risk, but also the amount of risks and duration of risk. And that is, of course, both through their living environment, but also through their lifestyle in that living environment. And then it can also be different susceptibility, that people are differently susceptible to have be affected by risks. So it's both the social background in terms of knowledge, but also money, financial resources, and power, if they can influence the factors that can lead to differences in risks. So both those are more individual factors that are affected by the social position that you have in society. And then finally, of course, we also have differential social consequences. So when you had an injury, it's also the impact that might vary due to the social group that you belong to or the social position that you have. So that's, of course, if you have insurance, health insurance, or if you have money for treatment and rehabilitation, if you have access to healthcare, and this is also a matter of if the society, how the society choose to again distribute different resources and money in terms of health policies, if you have a universal health coverage for the people so that they have something when they had an injury, and also in terms of unemployment after an injury. So we talk about the poverty trap, for example, after an injury. And then, of course, the society can modify these different mechanisms in different ways. So, as I said now, to influence the social stratification directly by different type of policies, obviously the most difficult part, but it's still something that the society can do. And then to decrease differential exposure to risk, so that's more to create safe environments. For children, for example, it's to have access to safe place to play, like playgrounds and things. Differential susceptibility is more about affordability, to afford safety, and also to have access to safe products and protection, to know about them and to have them accessible. And then to prevent differential consequences, and that more, as I said, about equal access to care and rehabilitation. So all of those are things that the society can do in different ways to try to modify social differences in injury risk. There are very few studies that have looked at intervention, how intervention actually affect different social groups, or if it's effective in the same way in different social groups. And I will give you some examples. These examples are also from high-income countries. It's actually mainly from Canada, these examples, but it's more to give you an example of how it can look like. So this is a study of a bicycle helmet law in Toronto that was introduced in 1999, and it's a bicycle helmet law for children up to the age of 18. And then they studied the effect on helmet use, bicycle helmet use after the legislation. So if you look at the first bars, is before the legislation, children from high income areas had double the use or twice as use of bicycle helmets compared to children in lower income areas. And then if you look at the second ones, after 1 year after the legislation, both children from mid-income areas and low-income areas increased their helmet use. So the difference towards children from high-income areas was just 1.2 times higher. And even children from high-income areas increased their helmet use, but not to the same extent as the other children in the other areas. But then if we look at the last bars, 6 years after the legislation, we see that the bicycle helmet use have decreased in the poorer areas, not so much for children in high-income areas, and then it's a big difference between them. So it's nearly 3 times more likely for children in high-income areas to wear a helmet after the legislation than for the other areas. There's also another study looking at that, but with more community-based program to increase bicycle helmet use, where they also had informations and they had lots of different activities to increase bicycle helmet use, but they also had a subsidized program where they subsidized bicycle helmets for children. And then they looked at the increase of bicycle helmet use after this community-based program, and they saw that the increase of helmet use, the first bars to the left, that children in average rich areas increased their use more than children in poorer areas. So it seems like this community-based program was more effective for children in richer areas than in poorer areas. But then they also looked at head injuries, so reduction of head injuries, the second bars towards the right. And what they saw then was that the effect on head injuries were more or less the same in both areas. So it seems like the increase in helmet use that we see in the poorer areas had an effect on injuries also for those, even to the same extent that, or more than, if you say that the increase of use was lower in that group. But it seems to have an effect on head injuries anyway.
So
Yep.
Marie,
Yep.
If I can interject again, you know, what you've just pointed out is that inequitable access to resources in some ways influences people's adoption of safety measures, in this case, bicycle helmets. So I'm wondering, how does one address where there are competing demands and the demands that speak to poor people's immediate livelihood needs? How do we find a synergy between the safety agenda and what people obviously, especially poor communities, perceive as a priority, as, you know, with respect to livelihood and daily survival? How does one find synergy? How does one start that dialogue and that conversation so that safety is not seen as a luxury or as something outside of livelihood and survival concerns?
Yeah, of course, that's a really important and difficult thing to do, and I think we have to understand that people have other priorities in life, and we have to understand why they can't do it and why they won't do it. So that's probably the first one to do, to try to understand that, and then things can, well, it has to be accessible. So even if there are subsidized for helmet use, there might be other barriers that we have to overcome. And I mean, if you have other problems in life, you won't try to find a bicycle helmet for your children. That doesn't say that you are concerned by your child's safety, because that goes for all parents, I guess. But it's I think it's more a matter of trying to understand the perception and the needs that people have, and then, of course, I mean, also work with other layers, as I said in the beginning, that the lifestyle factor of road safety behavior are also influenced by other things in society. So if you go upstream and don't just focus on the lifestyle, then you might find other ways that are more effective, like making a more safe environment will definitely be more effective. So not exposing children, young children, for heavy traffic, for example.
Well, let me take one of the questions that just has come in. It's a two-part question, but let me read out the first part, since it speaks to helmets, and then I'll come back to the conversation you and I are having. It's should bicyclists in low and middle income countries wear helmets? And I would add, in the context of our conversation about the inequitable access to resources and competing priorities, how does one address this question? If the answer is yes, in the context of
so I would first,
impediments.
Yeah, first I would say that this is, first, it's not the promotion for bicycle helmets. This is not the point of my presentation. The point was more to show that even if you have a law or if you have a community intervention program, it might not affect children in different income level areas to the same extent or in the same way. So I would not say that that's the most or the first priority, but it's also very difficult for me to say, coming from a high-income country. So I would not say that that's the first thing to do for bicyclists in low-income countries, no. And that was not my point to make like promotion for bicycle helmets. motorcycle helmets is another way. It's another thing.
So I guess if not helmets necessarily, how does one, and I think you were getting at it just now earlier, on what are the kind of measures one would call for to assure safety for all sectors of society and not just for the well-resourced. In the case, what are the kinds of things beyond helmets? Helmets is dependent on individual choice.
It's depending. I mean, it's well, we all know that passive intervention is more effective. So if we make safety passive, that you don't have to do anything, then you're more you can succeed. I mean, in that. Looking at child safety in Sweden, we see that most of our measures that have been taken in Sweden is what we call passive measures. So it's more to make children safe without they having to do anything. So it's definitely not the bicycle helmet that has helped us in Sweden either. We have a helmet law up to the age of 15, and when that was introduced, we also saw a decrease for the age group 13, 14, and 15. So I think it's not the answer, and that was not my point here either. So it was more to show how it's different in different groups. And I think it's a good example. Yeah.
So the passive interventions that you're pointing to is dependent on systems, right? It's dependent on larger structures. It's on corporate entities, government entities, road designers, and so forth. It's not dependent. Well, in some ways, that decision on what gets implemented in the road is a municipal or road agency decision, right?
No, it's definitely a policy question as well, a structural question.
Structural question.
Yeah.
So I know you make the point later about how road structures are organized and infrastructural initiatives generally tend to support the interests of the motorists or the motoring public. And safety concerns for the non-motorized, for the vulnerable road user, is often absent or totally ignored. How does one engage with that, especially if you're thinking that the passive intervention is the one that is perhaps most feasible? How does the traffic safety sector engage with those infrastructural interventions and state interventions that ignore the safety of the most vulnerable?
Well, first, I think that we have to see them. We have to see the vulnerable road users. So the infrastructure and the transport system is very much focused on motorized vehicles and private vehicles. And that's the thing in nearly all countries. So we have to see the pedestrians, we have to see other vulnerable road users, and it has to be a focus on them as well. And it has to also be a focus on public transport. In many countries, it's non-existent. So private vehicle is the only way to transport yourself. So that has to be discussion on a policy level that public transport has to be increased.
So I guess my follow-up question, I'm just wondering aloud now, is how do traffic safety researchers and practitioners make the vulnerable visible? They're invisible in the public policy frame, and they're invisible in the dominant structure, road structure. What are the kinds of initiatives and questions that traffic safety practitioners and researchers should be asking to visibilize the vulnerable road users, the pedestrians, the cyclists, the motorcyclists, etc. What are the questions and a kind of series of activities we should be looking at beyond this kind of presentation that you have, where you're looking at numbers and you're looking at, you know, how do you bring a human face? Because these people are not just numbers. There's how do you bring that human face forward?
I think, data is just numbers, but it's still powerful. So data is important, of course, to show the problem. Then you need to see the persons behind those figures, obviously. But it's also a power imbalance between the people that have their say in policy. So I think that we need to advocate vulnerable road users or pedestrians, so that it's a class difference. So that's the cars and the car drivers are usually from a higher class, so they will have more say in policy making. So we have to have representation of other groups as well. We have to have representation of children, of young people, of women, of pedestrians, motorcyclists, and all those other groups. When it comes to policy, we need to have reference groups where they also have a possibility to describe their situation. So looking at children again, we usually say that we have a children perspective, but that perspective is usually formulated by adults, not by children. So we have to have a child's perspective. That means that the children needs to be able to say how they experience traffic and how they experience risks in their environment and in traffic.
That's great. I like this where you just talked about, for instance, children's voices being heard. And I guess I want to just probe that a little deeper and say, so how do we, as traffic researchers, traffic safety practitioners, what are the kind of modalities and methods that we could introduce alongside all, the statistical work and the important quantitative methodologies? What are the approaches and methods we could begin to think about that could surface children's voices and other vulnerable groups' voices? Are there any creative examples that we may have from around the world where such work has been done?
Yes, I think that we come a long way of having a reference group of young people, even if there is just a few number of young people, and you usually get the ones that are already engaged. So it's not representative of all children, but we had a governmental commission working on child safety, not only road safety, but all type of injuries in Sweden. And we had a group of young people in that commission. And when the adults started to talk about things and they addressed it to children, then they could say that that's not the case. We don't want, like they said, we don't want the law for bicycle helmet law for children up to the age of 15. We want it for all age groups. We think that bicycle helmets is something that is related to cycling, not to age. So they had these, it meant something just to have them in the room. And since they were very engaged young people, they were not afraid to speak up. And so even then it was very effective. But another thing is the photo voice, where some projects have given cameras to young children to just to take photographs of their risks in their environment. And it has shown that it's not the same risks as has been defined by other people. It's different kind of risks that they document, children and young people. So that will also be one way of doing it.
Photo voice is such a powerful modality, and it's been used increasingly across a number of health and social phenomena.
Yeah.
Colleagues did a multi-country study on using photo voice on children's understanding of safety in 6 African countries. And as you pointed out, it is amazing the meanings and the dimensions that children bring to our understanding of safety. And what I found fascinating in that work and similar other work, where issues of traffic safety and safety in general are tied to matters of environmental degradation and environmental conservation, as well as to matters of food security. And, you know, it's, the children actually speak to the social determinants of safety in quite an elegant way, using their own language and so forth. So I guess my follow-up to you is then in the example of including young men, the children in the Sweden example. What was the outcome? What was some of the lessons there?
I think that the lessons, one of the lessons were that they, the problems formulated by grown-ups in the commission was more that this is a new risk for young people. For example, they brought up self-harm, like cutting and things. This were like 10, 15 years ago. But then, so they brought up that as a new problem, and the young people said, "This is not a new problem. We see this all the time. So many of my friends are doing this," and so it was kind of refreshing, even if it was obviously a problem. But I mean, it's and worrying. But it was that they were more reflecting their environment now. And it was a long time since we were young, so we see it with our own eyes. So it's, I mean, we need them. And it's the same with the photo voice, as you say, they actually capture what they see. It's not the environment that we live in. It's not the risk that we are exposed to the same extent. So I think it's powerful, yes, to have them there, to show that. When you show that material to policymakers, they can't say that this is in another country, another region, another municipality. This is actually happening in your own community.
Mm-hmm. So it brings a social embeddedness and an urgency to the matter. It brings a local relevance to the work. But I think what we're getting in at is there are implications for how traffic safety research would do well to widen its scope of questions and its areas of inquiry, so that the social relevance and the situatedness of the work is lifted.
Yeah, I think we have to see it as a social issue as well. Okay, so I'll give you just another example with that was very popular. It has been popular for some times, walking school buses, where you have problems walking or taking your children to schools. And so this is that some grown-ups walk a group of children to schools. And a study from Auckland showed that there was a higher uptake of these walking school buses in more affluent areas. And then they asked the parents about safety, and not surprisingly, all parents had the same concern about safety for their children, but there were other barriers. And as we have discussed already, there were barriers of time and taking on the responsibility. So that was different. So it's again something, it's an intervention that rely on parents' ability to have the time, to have the money, and to have the skills maybe to take on the responsibility. So it's more towards, even if the aim is to decrease exposure or have the same exposure for all children, it's something that goes more to the differential susceptibility than for the exposure. And then it's another study looking more at the environment, the traffic environment, and they saw that the poorer areas also had higher exposure to traffic. So even if they controlled for the traffic volume, they saw that there were more injuries in poorer areas with major roads and more poor roads crossings. So these are more examples, even if they come all from high-income countries, it's more an example that the very few of the interventions that we do that actually look at the effect in different socioeconomic groups. And that will be the same for both for high-income countries and low and middle-income countries. So there are a number of policies and policy reports that have put equity and determinants of health on the agenda for a long time. The Commission on Social Determinants of Health was published in 2008, called the Closing the Gap in a Generation, and they say it's more an aspiration than a prognosis. And they have a holistic view in this report. They emphasize a lot how money and power and resources are distributed, and discuss different policies on how you can have a more equal distribution of power and money, and also how to improve daily living conditions, and to measure and understand the problem and assess the impact of action. And that's what I just discussed, how important it is to actually have data and monitor the problem, and also to see how it looks in different groups. That's also why data is important, but also to assess the impact of different interventions and actions that we do. They, of course, also state how important it is with economic growth in many countries, especially countries with high level of poverty, that economic growth is something that is needed. But at the same time, it can't stand alone. You have to have different policies that safeguard a more fair distribution of those increased economic resources that in a society. So that's also important. So that was that Commission, and then of course we have the Sustainable Development Goals that all of us talk about these days. They were implemented in 2015, and there's different definitions of sustainable development. One is that it is a development that meets the need of today's generation without compromising with the ability of future generations to fill their needs. What is not said is that the needs of today, what do we actually mean when we say the needs of today? What do we need? Do we need a private car? Do we need 2 cars? Do we need to have the same resource use as we have today? So it's probably also a discussion. I will come back to that in a while. And transport in these goals, it says that it's not an end in itself. It's more a means to the end. So traffic has direct relation to some of the goals, but it also has indirect relation. But we have the health goal, for example, where we have a decrease of both death and injuries due to road traffic accidents. We have the affordable and sustainable transport systems, but also to provide access to safe and inclusive greens and public spaces. But there are also other goals that are more indirectly affected or related to traffic. There is, however, it is a contradiction between economic growth and sustainable resource use. So economic growth, probably the majority of the goals are oriented towards economic growth, or more towards economic growth, which is important in many countries. But at the same time, we have to, so for many high-income countries where we have a high living standard and a high use of resources, we also have to reduce our resource use in absolute terms. So we also do something for decreasing the resource use that we have today. So traffic is one example that it stimulates economic and social development, but at the same time it brings problems in terms of traffic congestions, air pollution, and traffic accidents. So we have the balance between these two when it comes to traffic. And we have balance or a competition between the public health approach or the public health goals and the traffic as essential economic infrastructure that we have. So as I said before, we have a focus on both developing and maintaining the infrastructure for private vehicles, which is of course important for economic growth and economic development. Roads are obviously important for many things and communication between us and infrastructure, but at the same time, we do less for public transport and pedestrian safety. And if we're going to achieve the goals to provide access to safe and affordable, sustainable transport system for all, we need to have more attention. And it also says that in the goal that we need a special attention to the needs of those in vulnerable situations like women, children, persons with disability, and older persons. So again, we're coming back to that, what we just discussed, Mohamed, that it's also a need to have more focus on that if we're going to do, and we can ask ourselves if we have these Commission on the Social Determinants of Health, 2008, the Sustainable Development Goals in 2015, we also need to, why doesn't it work? What is it that we need to do to make it work? And as I said, it's a balance between these different goals. So I think that the goals have strategic potentials that are important, and we need to discuss. We have to put traffic safety on the agenda. We need to discuss it both in terms of road traffic and sustainability, accessibility to active travels is something that we discuss a lot now in Sweden, that people need to be able to move around, and the active mobility and active travels. So it's a balance between the transport policy objectives, but also the public health goals and the SDGs that to some extent include public health goals and transport policy objectives, but also have other goals that compete with them. So I wanted to show you these and discuss this. This is it's an article from 2013. It's Iris Borowi, and she's a medical historian, and she has suggested factors that prevent prioritization of road traffic injuries on the policy agenda. And I think that they are still valid. So first, she emphasized the economic interest of the car industry and petrol industry, and that's of course the power balance between the actors in policymaking, that we have strong economical interest from those industries, but also the concept of modernity as motorization, so that modernity is equal to motorization, in a sense that we have to discuss that as well as a sense concept. And as I said many times now, but the infrastructures that privileges motorized vehicles, and the class difference between car drivers and vulnerable road users, especially in low-income countries, but it's the same. Well, it's not the same, but it's to some extent it's the same even in high-income countries. She also brings up the misleading assurance of a Kuznets curve-like concept, that the solution for low-income countries, as you asked in the beginning, Mohamed, that the solution for low-income countries is to become a middle or high-income country. And we can't see that as a development because of as I said, the development of motorization in high-income countries does not need to go through the same development in low and middle-income countries, so they can take on more modern way of thinking about safety. And it needs to be a reconceptualization to separate motorization from economic development. So these are two things that we need to discuss together: economic growth, but at the same time to increase safety for all people. And just to conclude that before we have discuss more is that the beginning of my presentation was more to show that if we look at different means of prevention, they may not be equally beneficial for different social groups or living areas. So we have to look at that, how beneficial they are in different social groups and in different areas. When you have an intervention, you need to consider also social differences, both in the planning but also in the implementation and evaluation of those preventive actions. So you have that, you take that into consideration already when you plan an intervention. And then to include health equity in all policies, it needs to be highlighted and included in policies, and injuries should also be consequences of social policies, to look at that. And as it is in universal health care coverage, injuries is usually used as an example of those that need health insurance in a very direct way. So, and to address joint outcomes, to look at the both safe and supportive environment, but also have a more or a stronger focus on vulnerable road users.
Marie, thanks so much. You've given me certainly a lot to think about, and I'm sure you've given the participants to this webinar all kinds of questions. I'm hoping that people will post the questions. But a key issue, listening to your presentation and the matter that you return to constantly, is really about the social determinants and the structural drivers of safety, traffic safety. And the drivers that you refer to are really all the conditions that make for overall well-being and for thriving life. These conditions that are related to traffic safety are the conditions that make for a safe and a wholesome life. Yeah. And so my question is, and I'm intrigued, this seems to be a challenge facing all categories across disciplines, across issues of academics. We're very good at looking at the science of our work, looking at the methodologies, ensuring, and it should be, that the evidence we produce is defensible, that we have clear case. But there's a disjuncture between what the issue is and the need for scholarly activism, for want of a better word. It's obvious here that we need to think about our roles more than just producers of data, of empirical evidence, that we also have to think about how this data and this very useful information is not just translated, but communicated by the researchers themselves in the public domain as part of a larger socially embedded activism program. And so I wondered, for traffic safety practitioners, what would this activism be? What would it look like? Or is that activism somebody else's business? Is that somebody else's responsibility? Or should we rather be thinking about a more integrated approach, that we move between different functions in this work of traffic safety promotion?
I think that is really something that we struggle with all the time as public health researchers, to what is our role as researchers, and if we go upstream, where do we stop our engagement, and when do we become politicians? So that's certainly a difficult role sometimes, but at the same time, I think that we have an important role to play with the evidence that we have. So even though we discuss methodology, design, sample size and things, it's also important that we have good evidence. So now with the activism, it might be that I interpreted this in another way, but activism sometimes seem to be more from a very personal engagement, and sometimes if it's activism groups, they tend to do the same thing or focus, for example, on more an individual road safety behavior. It's I don't say all of them because activism is important, and it's important in many countries, but I would probably say that it's important to have an interaction or some kind of communication between, so that we are better in communicating the interventions that work and the interventions that have an effect, and the evidence that we have. Not so much discussing maybe methodology or study design, but to actually show in maybe popular science way that this is what we know today, and this is what we know that don't work, and this is what we know that does not have the same effect in all social groups, that might even widen the gap between social groups. So I think that it is definitely important, but it's probably again that we need to communicate with each other, and it has been, it's not as much today, but it has been more, at least in Sweden, has been that road safety engineers have a closer contact with researchers, so that it's a communication about the new evidence that we have and the way that we can also improve the environment or the roads environment. So yeah, I think it's not a straightforward answer, but it's a complicated issue.
But perhaps, Marie, we are complicating by creating a binary, by separating what one could term academic citizenship or scholarly citizenship.
Yeah.
That in much as we are researchers and you're working from a particular way of making sense of a reality from a science base, it's a very particular way of making sense. But surely there is also a need to think through. So as academic citizens, and in most countries, we are paid by the tax dollar. So we have a social responsibility to extend and start thinking beyond just generating the data. And how may we organize the traffic safety and the injury sector more broadly, organize itself as a citizen focused, as a public focused activist group that moves from data, that ensures that its case is credible. And in any case, there are always gaps in information in the science, constantly learning. What we know now, we did not know 50 years ago. So also to recognize the humility that we have to be humble about our positions and recognize our gaps. But I just wondered, with your background in sociology, how do we think about this, creating synergies? And it speaks to the issue of intersectoral collaboration and public engagement. How do we do this? How do we move our engineers, our epidemiologists, our methodologists also to this other terrain of work, of scholarly activism? Yeah,
it's definitely important. I think it's less. It seems like it's less nowadays than it used to be, but it's definitely dangerous if we isolate ourselves at the universities being academics and not discussing. We have a third issue in the society too, and I think that maybe the most important thing now for public health researchers is communication of data. How do we communicate data, and how do we communicate to society, what we actually have found in the research. So it is something that is really important, and we always talk about intersectorial work or multidisciplinary groups, and I think that still is important. What we have to make sure of is that we have a power balance within that intersectorial group. Because many times, at least in the ones that I have participated in, it's definitely so that some people have more power than others, and the decisions are not made on the meetings within that intersectorial group, it's made somewhere else, many times by the more powerful participants in the group. And to look at the group also from that perspective, that it's not a group that just should come together and talk about things. It should be something coming out of that as well. So everyone come in with their expertise, and it should also be why they participate and what they can contribute with in that group. So it's more than just a group sitting down and talking about different things.
Yes, I just want to encourage the participants to send their questions through on the Q&A. I don't see any questions coming through. There are few, but while we're waiting for that, Marie, it sounds like we have to take this discussion, and there's a comment from Dinesh and somebody else, whether you think the kinds of issues that we are raising and talking about needs further amplification, elaboration, if there's a need for further conversations around these issues that you and I have begun chatting about. And if so, how would you see those follow-up conversations taking place with a more engaged participant involvement? Obviously, this format limits that, but would you think that the issues that have been raised here require further consideration and further elaboration?
Yeah, I think that, the factors that were brought up by Iris Borowy, that this concept of modernity and motorization, we have to discuss that to some extent, and the balance between economic growth and road safety. But what would be also interesting to discuss is how we can contribute to the SDGs. What we can do as researchers and traffic safety practitioners when it comes to the SDGs. How should we see traffic in the SDGs, even though the SDGs are, it's a policy, but it's a policy that everyone discusses at the moment. So we need to sort of discuss it from our point of view. And we, maybe researchers, are the one that can also discuss what is missing in the goals and how road safety should be formulated or discussed in the goals, so that we maybe more a critical view towards the SDGs or to other policies, just to how can we, what can we do now to try to prioritize safety on the policy agenda.
Marie, that's again, I like what you've just said, and it opens up, it takes a conversation perhaps in a slightly different yet related direction. It begs the question on how we formulate the questions, all right, as traffic safety practitioners. Whose questions are we asking, and who's formulating these questions? And how do we ensure that the questions are pertinent to the most vulnerable, to those who are most excluded? And should we begin looking at more participatory approaches to research. So as we had said earlier, for instance, if you include children's voices, you get a very different perspective, and in fact, a far more nuanced perspective. So how do researchers begin moving the terrain, so to speak, and shifting towards ensuring that the questions and the research projects are not just driven by empirical and intellectual curiosity or empirical data, but they're also driven by realities on the ground and by, you know, an embeddedness in society.
Yeah, I think it's a raised hand. Someone want to come in? Do you have a question from someone? Now we can't hear you.
It says the SDGs on road safety takes a very technical approach to safety. And how do we move around that? How do we get to a more socially embedded and animated approach rather than a technicist approach to safety?
Yeah, and well, it's a difficult question to answer, obviously, but it's. I think it's also because of the people that are engaged in formulating the goals, and again, participatory approach where people actually are involved more, but also that we discuss it from our perspective, from traffic safety perspective. Should there be another way? Should we include social issues? Should we include social perspective in that? There are definitely social perspective on the environment that are included in the goals.
So I guess this is repeatedly coming back, you know, the different issues that we've raised is there seems to be there's an imperative for safety researchers to be engaging with a range of stakeholders, interest groups, influential groups, as well as marginalized groups, to ensure that traffic safety is firstly taken seriously. But if I can just hone that comment down, it seems that traffic safety is very much a social justice issue. It's a human rights issue. And yet there's very little engagement between social movements and the movements that are focused on environment, on food security, on quality of life, and the traffic safety sector. Despite the rhetoric of intersectorial and multidisciplinary, the calls and the rhetoric, there's very little. And how do we get this very important agenda and priority embedded within social movements and groups that are influential in society, and that could assist the traffic safety movement to lift its game and to attain greater visibility and salience across societies?
Yeah, how do we do that? And that's a very difficult question, of course. I think that, well, my thinking is also that traffic, as I began with, that it affects all of us, and it has benefits, of course, that we, it's something that is not only negative, but I mean, road safety positive, but the things that prevent road safety is something that is beneficial for many of us, that is fun for many of us. So it's really a balance between that. I think that the groups that have managed to raise their voices is the more environmental focus groups, ecological focus groups, and The air pollution is something that probably can link us together. I mean, the other negative effects than road traffic injuries from transport and the road environment. So that might be one way of raising road safety together with more environmental things.
So I think what you're proposing is that we should be alert to possibilities of connections and linkages with other movements and with groups concerned with the social determinants of well-being and safety, to look at how one does that. And I wondered on that whether there should be a directed and concerted effort to bring in more social scientists like yourself. You have background in sociology, behavioral scientists, perhaps even philosophers and historians into this traffic safety, because it tends to attract the epidemiologists, the engineers, public health people, but there are a whole range of disciplines and activist groups that could enrich the movement and enrich this work. And so I just wanted to have your thoughts on that.
Yes, I think it's a very good idea. I think it's needed. I mean, the engineers are definitely important, and they can fix things, and they can build and improve environments, and they can do lots of things that are good for traffic safety. But at the same time, we need to understand why people don't do as we want them to do. And we need to understand the living conditions that people have and why they can't prioritize certain things. So we need a multidisciplinary collaboration. We need different perspectives. And I think that also the historical perspective is interesting, because it also looks at the development of motorization in a way that it's something that we now believe it has to be there. We need to have cars, but I mean, we have to see a future where we maybe don't have cars, or not cars in the same way as we have now. And we have a society that looks totally different than it does today. So yes, I think it's a good idea to have discussions with people from different backgrounds. Yes.
So just maybe two related comments, questions. We know this, and why isn't it happening? We've heard this message about intersectoriality, multidisciplinarity, but it's not happening. Why isn't it happening? What are the obstacles that we need to pick up on? And the point that you just made, it's the way in which we approach traffic safety and safety generally has to be connected to the kind of society we want, the kind of society we envisage for ourselves, an inclusive, non-discriminatory society in which people can thrive, and all the conditions and arrangement to thrive are present. And yet, motorization is often part of the problem rather than the solution. So how do we get philosophical about this and then operationalize?
I think if I had the answer on that, we have already had the solution, because it's now, I mean, it is not easy. That's why it hasn't been successful in all these years. I think that the intersectorial groups they have to be developed in a way that are participatory, in the way that people can participate with different views, but also the power is probably the main problem of those groups. That some of the participants have more power, and if the ones that have more money have more power, usually, then they will have more stronger say in that group. And it's I think it's the same as with children. Again, if we have a reference group of children, it will be like interesting to hear what they say, but then the decisions are made without them being involved. So it's a matter of where the decisions are taken and really who participates and what mandate do they have when they participate in those groups.
Marie, thank you so much. I've enjoyed this conversation. I hope you did. Time has passed so quickly, the 90 minutes. So we come to the end of the webinar. Thank you so much. Thanks to the host and the organizers of the conference and this webinar. But perhaps the last word to you, Marie, before we shut off and people can move on to the next webinar. So perhaps just, the last word to you on how you see going forward.
Thank you, and thank you for inviting me, and thank you, Mohamed, for raising very important questions and challenging questions. I think it's good to have this question for all of us so that we can continue the discussion. And I enjoyed being it's interesting to talk about social issues and road safety. So I enjoyed that. I enjoyed our conversation. So thank you.
Okay. Thank you very much. Over to the host, and thanks to Maria, Dinesh, Kavi, and all those who assisted. Bye-bye.
Bye.